Hello everybody, I hope this finds you well. I'll start off with an update on our COVID numbers and just talk a bit about some of the pressures on our system at the moment. And then I'm just going to say a few things about some of our staff. So just to start with the COVID numbers first of all, we have seen quite a big increase in new cases over the last few days. So new cases reported were over 500 2 days ago. And yesterday 935 new cases in Lanarkshire, which is the highest number we've ever seen. So obviously that is a cause for concern. However, we will need to see if these new cases translate into admissions. Our numbers of inpatients are currently sitting at 55, so these have also gone up. Most of these new cases are sitting in the younger age groups, but about 2/3 of them are in the younger age groups. But about a third of them are in older age groups, so a bit of a spread across the population as well. These are not clusters of cases, it's widespread community infection at this point, so we need to maintain all of our safe practices, like keeping a safe distance, wearing masks when we're inside and keeping our social contacts still to a minimum. The other thing, of course, that you can do is test before you meet up with friends and family. Just do your lateral flow tests, and all staff should be remembering to test anyway, please, if you can, twice a week. It really helps in terms of our battle against this horrible virus. I'm going to say a few things about some of our staff. I'm here at Monklands today, and I have to say last week we had quite a challenge in terms of our ITU capacity with a number of 3 cases that needed to go to ITU as emergencies, and we actually had to bring in additional staff on a very short notice basis, and I have to say the team responded fabulously and managed to sort out that pressure, so thanks to all of those that were involved in that great response, so thank you. Secondly, we've had some really complimentary feedback around our podiatry services recently, which again is really lovely to hear, and really going that extra mile in terms of patient care delivery, so lovely to hear that as well. And we get lots of nice feedback from patients all the time about the wonderful service that our staff do provide, and I think it's important that we do feed that back to you as well, so that you know that your efforts don't go unacknowledged. I also wanted to just recognise the contribution of 2 of our non-executive board members who will be leaving our board in NHS Lanarkshire after 8 years of service. So we have Phil Campbell and Margaret Morris. Now Phil Campbell has been our deputy chair in Lanarkshire, and he will be leaving, and as will Margaret Morris. So just really want to take the opportunity to thank both of them for all of their contribution to the running of the board over those eight years, and to say thank you. We'll obviously do that in other ways over the next few days and weeks, but I wanted to take the opportunity today just to acknowledge that contribution as well. Thank you, and I hope you have a good weekend when it comes.